Hey folks, Dr. Joe Esposito here. I am certainly glad you're with us today. Today we're going to talk about a really important topic because everybody relates to it. And we're going to talk about getting your brain working better and how your gut is linked to your emotions. And this is important because I've been in practice a long time and I've seen, I'm going to guess, tens of thousands of patients. And between our radio shows, television shows, books I've written, lectures, podcasts, website, we've reached hundreds and hundreds of thousands of people across the world. And so many times people come to me and they say, Dr. Joe, I'm anxious, I'm depressed. I had somebody the other day working on my house, doing some work on my house. And when he didn't realize who I was at first. And then he realized, you're Dr. Joe. And so we chatted a little bit and we start talking about health and anxiety and, being married, having kids and his situations. And so we're going to talk about your gut and depression and emotional health. And you need to listen to this because almost everybody I know has something wrong with their gut and they never linked it to the brain. So it's a lot of fun. If you have questions, you can always send me questions through our website, drjoe.com, drjoe.com. And it doesn't have to be necessarily about this topic. Any health questions you ever have. And the reason we do this, and it's a lot of work on our part, believe me, Joe, my assistant, and I answer the questions on a regular basis every day. We do this because so many people have health questions and they don't know where to turn. They've gone maybe to several doctors. Maybe they're not happy with the diagnosis they got or they're not happy with the treatment they've been getting. And they want to know if there's anything else that can be done. And the answer is usually yes. Now, I'm not going to say we can cure everything, but there are things we can do to help just about everyone across the board, which is really cool about this job. I had a lady come in the other day. She works for a major TV network. And she's a fan of the show, and she came in and we were chatting, and she was just fascinated with everything we were talking about. And she said, why is this not mainstream? Why is this not being taught everywhere? And the answer is, I don't know. There's not a lot of people that do what we do in our offices. That's why. And in the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. So let's jump into the topic. Again, any questions, you can always send them through the website anytime, and we'll try to get to them as soon as we can. So depression, we'll start there, is the most common mental health condition in the U.S. 21 million Americans, 8.4% of adults, experience at least one major depression episode in a year. That's crazy. Almost 9% of the people, 9 out of 100 people have a major depression episode. Antidepressant medications remain the first line of defense for depression, even though 2/3 of depressed patients don't respond well to them. The only line of defense, main line of defense, I shouldn't say the main line of defense is medication with 2/3 failure rate. They don't respond well. So if you drove a car and 2/3 of the people smacked up their cars, you wouldn't drive cars anymore. If 2/3 of airplanes crashed, you wouldn't do it anymore. Yet for some reason, this is all we got out there as antidepressant meds in the mainstream, and that's what people are using. The good news is there's a lot of other alternatives. I'm not saying don't take your antidepressant meds. What I'm saying is let's do what I'm going to teach you in addition to your medication, and let's see if we can get you well. I had a patient the other day, and he said, Dr. Joe, I want to start taking your nitric oxide, your super greens, and your essential source, but I'm on 2 blood pressure medications. He goes, I'm worried. What happens if my blood pressure gets too low? And I smiled at him, and I said, well, you can give up the natural treatments that you're doing in a healthy lifestyle, or you can talk to your medical doctor about giving up your blood pressure medication. Either one will work. And he smiled back at me. He says, you're right. Of course, I want my blood pressure to get low enough so I can get off my medication. I said, there you go. Don't do it without your doctor's permission, but that's our goal. So the U.S., this is a mental health crisis. This is a big issue. So many people struggle with depression and anxiety. There aren't enough practicing psychiatrists to handle it all. So to treat everyone affected, each of the 33,000 practicing psychiatrists in the U.S. would have to see 3,000 patients a year just to treat it. That's mainstream. Go to psychiatrists, they give you medication. You have to see 3,000 patients a year. It's not feasible for doctors to do that. And so we realize that this is being recognized as a big problem. And what's happening is we're starting to look at, finally, what's causing depression. And increasingly recognized there's a link between your gut and your brain. It's called the microbiota, and that's the bacteria in your colon and your brain. And it plays a role in psychological and behavioral functions that's often being affected and causing depression. Now, it's known, for instance, that your gut bacteria impacts the brain function and depression behavior, while people with depression have been found to have altered gut bacteria. So we know that the gut affects the brain. We know that people with brain issues have a bad gut. So there's a direct correlation here, and the research is very clear. There was a randomized control group, that was a test that was done, and it demonstrated that high doses of probiotic supplements are beneficial for people with depression, further highlighting the importance of tending to your gut for your mental health. So we knew it all along. I've known it all along. So now they're doing double-blind randomized studies, and they're finding that if we give people just probiotics, good bacteria, we see a benefit. Now, somebody called me the other day on one of my shows, and she said, Dr. Joe, I have some probiotics, and they're a couple of weeks outdated. Are they still safe? The answer is yes, but have they been exposed to heat? Because probiotics are heat sensitive, and they're bacteria, so if they get too hot, they can die off. Now, the good news is if you take a probiotic supplement, it's probably not going to make you sick. It's just not going to work. But that's why you want to get a good quality probiotic. There's two types. There's refrigerated, there's non-refrigerated. There's benefits to both. There's pros and cons to both. The refrigerated ones are really sensitive to heat. So they even get to around room temperature, they might start dying off, the good bacteria. The powdered ones, and that's the ones I use, it's on our website, drjoe.com, they're more heat stable, and so they're easier to utilize. So I take Dr. Joe's probiotics as part of my protocol every single day. If you take too many, let's assume you take a handful of them, you might get some diarrhea. It's probably not going to cause any damage to your body. So they're relatively safe, they're relatively inexpensive. The effectiveness, when it comes, in this case, to mental health, is well researched. So it's one of the tools in your toolbox that you can use to help patients get well. That's the nice part. And that's what I try to do, is give you as many tools as I can come up with to let you take control of your own health and manage your own health. And now you say, well, I didn't take probiotics. Okay, what else can we do? Well, we can fix the gut. How do we do that? Well, your stomach might be pushed up against your diaphragm. Maybe you're eating too much meat. Maybe you're eating too much charcoal and grilled food. And there's heterocyclic amines and polycyclic aromatic hydrocarbons that can cause cancer in the body. Maybe your stomach acid is too low. Maybe you need digestive enzymes. So there's a lot of different things that can go wrong with the digestive system. But think how complicated and sophisticated your digestive system is. You can eat a double beef little square hamburger on white bread with sugar that's ketchup that's 42% sugar, and you can still survive eating something that is so void of nutrients, and then your body still can suck out the little bit of nutrients that are in there and make you survive. You won't thrive. You'll survive. There's a big difference. I don't want to survive. I want to thrive. And so your body, the digestive system has several different places it can go wrong. And if it goes wrong, that's when it can start destroying the bacteria in the colon. You might expose yourself to fluorine, fluorinated toothpaste. How about chlorine in your water? All of these can be toxic because they act like antibiotics. Anti, meaning against. Biotic, meaning life. Antibiotics are against life. They kill off things that are alive. Probiotics, which is what we're talking about here, good bacteria, in favor of life. So just the name alone should tell you. So probiotics benefit people with depression. They did a 4-week study. This is just one study. 21 people received help for depression and received probiotics along with antidepressants. 26 received placebos along with antidepressant. A placebo is a fake medication. So I can put a pill, let's say a white pill, and say this is a probiotic, and it is. And I can give another person a white pill and say this is probiotic, and it's made with sugar or something like that. The people with the high-dose probiotics on depression did extremely well. The people that took the fake ones didn't do well. Again, direct correlation. So it's not clear exactly which specific bacteria improved the depression symptoms in this study. So what they did is they used a mixed or a broad spectrum probiotic. Now, you can be killing off those probiotics every day. You might take antibiotics. Those kill off probiotics. They kill off good bacteria as well as bad bacteria. If you take antibiotics, If you take antibiotics, I'm begging you, please take probiotics. And the way you do it is like this. If you take the antibiotic in the morning, take the probiotics at night. And Dr. Joe's Probiotics is on the website, drjoe.com. That's the one I like to use. Now, there's a bunch of different types of pro or good bacteria, probiotics out there. We have the most popular ones, the one that do the most benefit across the board in our supplement. We also put them in Dr. Joe's Essential Source. Now, if you've never taken Essential Source, you need to, by the way. Everyone should be taking Super Greens and Essential Source. They're 2 powders. They taste great. They take a scoop of each, mix them together, take them every day. I believe that we can solve a lot of health problems if we did nothing but put everybody on Super Greens and Essential Source every day. And the reason I say that is we've had thousands and thousands and thousands of people take it, myself included, and I've never had anybody say, boy, I wish I'd never taken that. Because in the Essential Source, we have probiotics, we have prebiotics. Prebiotics feed the good bacteria in your colon. So there are good bacteria, but they need to be fed. Prebiotics feed the probiotics. So that's why eating a good plant-based diet is loaded with prebiotics that feed the probiotics, and the probiotics help the body with the immune system, and in this study we're talking about today, help with depression. So this is where a good diet is so important. It helps the body function more efficiently. So stool samples, brain imaging, depression assessments were all used to evaluate the patients before, during, and after taking probiotics or taking the placebo or the fake one. An improvement in mood was noticed among all the patients, but those with the probiotic group, significantly greater improvements, along with an increased abundance of beneficial, what's called Lactobacillus, one of the good bacteria in their gut. I don't know how to make this research any easier for you. The research shows that it works. It's relatively inexpensive. It's extremely safe. Nothing's 100% safe, but it's extremely safe. Why wouldn't you do these things? Even if you don't have depression, why wouldn't you do these things to get your brain work more efficiently? I love having my brain work efficiently. I love being smart. And so you can do this too. Your brain isn't any different than my brain in most cases. I just take care of mine. So past studies on Lactobacillus during pregnancy and postpartum led to significantly lower scores of depression and anxiety in women in the postpartum area. Now, if you've been around women, if you are a woman that's had a child, after you have a child, many times you can slip into depression. That's okay. It's the body dealing with the major, I would hate to say trauma, but event of giving birth. And so the body can slip into depression. They find that giving certain types of lactobacillus help tremendously. It's also been found, if you're taking lactobacillus, to increase something called GABA. It's a neurotransmitter in your brain, and that helps suppress other neurotransmitters. Last week, we did a show on dopamine. Dopamine is a chemical in your brain that gives you pleasure. If you missed that show, go to my website, drjoe.com. You can type in dopamine. You can type in happy hormones. We call it the Happy Hormone Show. And listen to the show of how to increase the chemicals in your brain that give you pleasure. Naturally, you can do drugs to increase dopamine. But what happens is it produces so much dopamine that the body says, whoa, this is way too much dopamine. I can't handle this. I'm going to shut down. And that's why people that take things like ecstasy, for example, have this incredible rush of pleasure, and then they crash. What we're trying to do here is teach you how to normalize brain function. And when it came to depression, something as simple as probiotics helped women with depression after having a baby, but it also increased the production of GABA. GABA is a neurotransmitter that calms down other neurotransmitters. It suppresses them. 85% of your brain is 85 to 90% is used to suppress the other 15%. And so if you're not suppressing the neurotransmitters, if you don't have enough GABA, G-A-B-A, if you don't have enough of that, the other neurotransmitters and the nerves can fire off, and you might see things like Parkinson's. Okay, you might see things like uncontrolled movements, uncontrolled emotional outbursts. So the probiotics can increase the GABA, which can suppress those other neurotransmitters from firing off improperly. So the cool part about this, and I love this stuff, I research this stuff every day. And I know what works and what doesn't. I'm not saying we have a cure-all for everything. But the things you need to get the body to function properly: normally functioning nervous system, normally functioning digestive system, good nutrition. Those three things I feel should be the cornerstone of every health protocol, whatever the problem is. You can do other things. You can take medications, you can take surgeries, you can have therapies. All that's great, but you have to have a cornerstone. You have to have an anchor. And the missing anchor in healthcare is normally functioning nervous system, normally functioning digestive system, good nutrition. So if you have neck pain, back pain, shoulder pain, numbness, tingling, that's telling me that the nervous system isn't working as well as it should. Something's wrong. The number one treatment for pain is chiropractic care. Most effective, least expensive treatment for back pain. All the research points to the same thing. So if you have back pain, I can't imagine why you do anything you should start with chiropractic care. Get to the chiropractor. There's good ones and there's bad ones. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. All my doctors are handpicked by me. They're trained by me, and they're my personal doctors. They take care of me. And if I don't trust them putting their hands on me, I don't trust them putting their hands on you. So we have a really good team. I consider it the finest I've ever met as far as the team goes. So if you'd like to make an appointment, we have offices, like I said, Marietta, Duluth, Stockbridge, and West Cobb. Dr. Joe, drjoe.com. You can book it right online. You can call us. Phone numbers all over the website. We accept people with all insurances. It depends what your coverage is. We accept people with no insurance. We have cash plans, payment plans available, interest-free payment plans. We make it very easy to be a patient with us. If you're ever in a car accident, if the car is damaged, you're damaged. That's my experience. I teach other doctors, lawyers, physical therapists, all across, insurance agents, all across the country, how to deal with car accidents. And so if you're in an accident, you need to come see us right away. Don't waste time. Don't wait a week or two. Don't think the pain's going to go away. Come get an evaluation. If there's nothing wrong, I'll tell you. If there is something wrong, the quicker we get to it, the better off we're going to be. So you can book an appointment, drjoe.com. If you're just a regular patient, normally the first visit is $712. We've reduced that to $299. That's exam, x-rays, consultation, first treatment, going over the x-rays on your follow-up visit, complete nutrition evaluation. Nobody does all that I know of. drjoe.com. Stop wasting time. Stop wasting money. Because the healthier you are, the less expensive it is to live. And we want to get you well and keep you well. drjoe, drjoe.com. You can book an appointment right there. If you have questions about anything, a little bot pops up when you go to the website, drjoe.com. You want to chat? Yes. Send me your questions. I'm more than happy to answer your questions the best I possibly can. In most cases, we have answers that are going to blow your mind. I never thought of it like that before, Dr. Joe. That's why we're doing it. So we're talking today about the probiotics, the colon, the connection between your gut and your brain, beneficial bacteria, and depression. Study revealed several mechanisms by which beneficial bacteria may be useful in depression. It can alter the gut bacteria, favorably increase the good bacteria, and kill off the bad bacteria. If you have too much bad bacteria in your colon, that could be dangerous, could be deadly. So certain types of what's called Lactobacillus, one of the good bacteria, have been found to produce something called short-chain fatty acids. Short-chain fatty acids are things like acetate, butyrate, propionate. These help play a role in building the barrier in your gut, keeping your body healthy, keeping the immune system strong. So what happens is you put amazing stuff in your gut. You put alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, hamburgers, French fries. And then you say, I don't understand why I'm not healthy. I don't understand why I'm tired all the time. I don't understand why my brain doesn't work, why I'm constipated, why I'm fat. I used to be fat. I can say the F word. And we find out that you're dumping all this stuff in the body. Your body has to try to break it down into its components and then reassemble it into eye tissue and heart tissue and brain tissue and blood. And the better the raw materials are, the healthier you're going to be. And if you're dumping a bunch of junk in your gut, that can't work. Now, when you put junk in your gut, the bacteria, the good bacteria, the probiotics, break down the food into their constituents, or raw materials, and then help reassemble them. So if you don't have enough good bacteria, You can't get the nutrients out of the food. How do you build up good bacteria? You feed the bacteria. And you make them grow like you would a garden. What do you feed them? The best foods to feed bacteria, good bacteria, are fruits, vegetables, nuts, and seeds. The more fruits, vegetables, nuts, and seeds you incorporate into your diet, and the less of the bad foods you incorporate into your diet, or excorporate, if that's a word, you'll see some dramatic changes. And that's what I tell everybody. Do what I say. Give it a shot. Try what I say for 60 days. Take Super Greens. Take Essential Source. Take Dr. Joe's Probiotics. Take vitamin D. Take digestive enzymes if you're eating cooked foods. Give it 60 days. If I'm wrong, I'm wrong. So what? I'm wrong. But if I'm right, which I am, then you'll say, this is so easy, so quick, so cheap, so much fun, so much better than anything I've ever done before. And you'll say this, why didn't somebody tell me about this sooner? And my answer is, I don't know. I'm telling you now. This really, my goal is to make this lifestyle mainstream. Nervous system, digestive system, and diet. And I'm working on it. And we're making a lot of progress. More and more people every single day are coming to our side of the fence. I just saw that some comedian, I can't remember his name now. Anyway, a lot of Hollywood stars, a lot of athletes are getting into health food stores, health food restaurants, vegan restaurants. We're seeing more and more of it. And it's really exciting to see the changes. I've been doing this. I've been vegan now for 35 years. 35 years ago, it was rice and beans and then beans and rice. Now there's so many options. And there's a lot of junk food out there too. Just because something is vegan doesn't mean it's healthy for you. But if you're eating a lot of sugars and bad foods, you're just destroying the brain and you're destroying your moods. So the primary highway, the way the gut and the brain talk to each other, is through your vagus nerve. And the vagus nerve connects your brain to your digestive system. And it sends messages back and forth. Now, it turns out, this is kind of cool stuff. We always thought that messages had to travel up and down the brain, from the gut to the brain and back and forth through the vagus nerve. Well, it turns out your brain is on Wi-Fi. We can remotely send messages from good bacteria up to your brain. That's what we think is happening in many cases. Because we can't find any direct nerve pathways. We can't find the messages getting up to the brain, and yet they're there when certain good bacteria are in your gut. When bad bacteria in the gut, the messages aren't there. So we believe right now, and science changes, and that's the beauty of science, it changes. But right now, we believe your brain is on Wi-Fi talking to your gut. So you better have good stuff coming out of your gut. Now, junk food is linked to depression, and there's so many studies on this. Adolescents who eat a lot of processed foods, a lot of salt, high in sodium, low in potassium, fast foods are more likely to have depression symptoms. And I'll give you an example, personal example. I went into Atlanta last weekend, and there's a very famous vegan restaurant. I had one of their famous vegan hamburgers, or vegan burgers. And the first time I had it was delicious. This time was just okay. And so I had it. And then there's a vegan ice cream place down there. So I had a little bit of vegan ice cream. I just didn't feel good that day. And I didn't feel good the next day. That was one meal. Can't imagine doing this all the time. Folks, got to go to a break. If you have any healthcare questions, send them to me through the website, drjoe.com. If you want to make an appointment to come see us, to get an evaluation, drjoe.com. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. Follow us on social media. You need to do this. We post health tips every single day. People love our health tips. They're quick, they're easy, they're fun. drjoe.com is the website. Our handle on social media, at Dr. Joe Esposito. At Dr. Joe Esposito, all one word. If you're a podcast junkie, just type in your podcast service, Dr. Joe for the health of it. Again, our website, drjoe.com. We'll be right back. Hey, folks, Dr. Joe Esposito. I am, once again, very happy that you're with us today. We're covering a really good topic because all of us go through happy times and sad times, but we're talking about how important it is to have a healthy gut in order for your brain to function normally, and specifically depression, anxiety. So many patients, so many people suffer from anxiety and depression and don't know what to do about it. The main course of treatment, the primary course of treatment, I guess I should say, is antidepressants. And antidepressants work on 1/3 of the people. 2/3 of the people that take them don't do well with them. So we need an alternative when it comes to this. Now, it's not instead of, this can be an addition to. The nice part is if you get healthy enough, chances are you can drop out a lot of your medications. And we've done shows on diabetes and heart disease and anxiety and depression and obesity and cancer, and never, ever stop your medical treatments until you're well enough to get off those meds. My goal is to get you well enough to get off the meds. And that's a pretty cool goal, and I like it. So we started talking about children and depression. Given the substantial brain development that's occurring in adolescence, it's so important that the children get their brain fed because it's how the brain starts out. And if you look at the mass murders, the shootings, almost every one of the people that did the mass shootings, the perpetrators, were on antidepressants or some type of psychotic medication, antipsychotic medication. Almost every one, I think every one, from when I read one study, every one of them. And when the ones that didn't get killed or kill themselves, when they interviewed them, they all said the same thing. They said, I thought I was dreaming. I didn't realize that this was real. They've lost touch with reality. How can you kill 10, 20, 50 people? Because it's not reality to you at that moment, because the brain isn't working right. So, not saying any of you are going to do that, but I want your brains to work the best they possibly can. So, past studies have confirmed diet-depression link between children and teens. Researchers systematically reviewed 12 studies involving children and adolescents. The association was revealed between unhealthy diet and poorer mental health, as well as good quality diet and better mental health. Once again, this is not sometimes it works. This is not a maybe I'm not a candidate for this. We all benefit from a normally functioning nervous system, normally functioning digestive system, and good nutrition. We all do. And there's no reason why you shouldn't be doing this. Years ago, I came up with this statement. You have to eat anyway. You might as well eat good food. Just that simple. You have to eat anyway. Why not choose the good food over the bad food? The good food, if you do it right, is less expensive than the bad food. It's better for you. You feel better. You go to the bathroom better. Your love life is better. Your energy level is better. There's no downside to eating a good diet except one. And this is the one that makes people go to the bad diet. Bad food tastes good. It does. Absolutely. And that's why you're seeing so many companies trying to duplicate the bad food with better choices. Spicy chips. There's vegan choices now. There's fake meats. So many fake meats out there. Beyond Burger and Impossible Burgers and Imposter Burgers, whatever it is. I've seen them. So there's so many different companies trying to fake the bad food. Those aren't necessarily health foods. They're better than the animal version, but they're not necessarily health foods. Many times they have things like monosodium glutamate. Glutamic acid is an amino acid, and it gets into the brain and allows the brain to fire off and function normally. So we need glutamic acid. If you're doing monosodium glutamate, super high concentration of glutamic acid, it gets into the brain and it causes the brain to essentially fire faster than it's supposed to and can literally burn out your brain cells. So that's why a lot of people get headaches after eating Chinese food, because they use monosodium glutamate. Now, many Chinese restaurants will say no MSG added. That doesn't mean there's no MSG, monosodium glutamate. It just means that there's no MSG added. But it may be in the soy sauce. It may be in the sauces that they use. It might be in the toppings that they put on there. So be cautious with Chinese food. Notice how you feel after you eat it. If you eat it and you don't feel good, don't eat it. There's so many options out there. I remember years ago I had a doctor from the Philippines working with me, and he was one of my proteges. And he said, Doc, in the United States, there's so many options of everything. In the Philippines, you're rich or you're poor. That's it. Food goes, there's Philippine food. We don't have Indian restaurants and Italian restaurants and Chinese restaurants and, vegan restaurants. He said, it's a very different world. There's so many options we have here. So make better choices. My favorite food, I'm Italian, so forgive me, Grandma Esposito, when I say this. My favorite food is Ethiopian food. I love Ethiopian food. Now, they serve it with something called injera, which is it's a rubbery pancake, and you tear it off and you pick it up with your hands, you eat it. So it's a fun food too. But a veggie plate, my friend Tim and I were talking about this the other day. A veggie plate for two people, $13. You're stuffed. So you still get a meal for $8 then. And the food is delicious. So, I mean, I like that. You can do Mexican, do beans instead of beef. Do a bowl instead of a wrap. Do a salad instead of a sandwich. There's so many ways to make simple, easy choices. So your eating habits play a direct role in depression. So if your diet is focused on ultra-processed foods, things that are lacking nutrients that are essential for mental health. Again, your brain needs nutrients to run properly. Things like vitamin B12. Researchers out of Turkey revealed that low vitamin B12 and low vitamin D levels, along with increased something called homocysteine, play a role in depression among children and adults. Homocysteine, where do we get homocysteine from? We get it from eating animal products that are high in methionine and cysteine that convert into homocysteine, which when they get in the body can cause the arteries to clog up. So homocysteine can cause cholesterol to stick to the artery walls. You get it from eating animal products like methionine and cysteine. So it's not really the cholesterol that's so bad in the animal products. It's when you heat the cholesterol, when you cook the animal products, it oxidizes the cholesterol. Homocysteine comes from methionine and cysteine, which causes the cholesterol to stick to the artery walls, which can clog up blood vessels, clog up brain function, and cause things like depression. I could just tell you eating meat is bad. I don't have to tell you why. Okay, so it's really simple. And vitamin B12 is important because, again, I'm vegan. I don't eat any animal products, haven't for 35 years. B12 is the only nutrient that, as a vegan, you have to supplement. And I take Dr. Joe's Essential Source every day, which has B12 in it. And I take Dr. Joe's B Complex, which also has B12 in it. The nice part about V vitamins is you're not going to overdose on them. You just pee them out. So if you take too much, you pee it out. And I'm okay with that. I don't consider it expensive urine. I consider it making sure I get enough B vitamins to make my body function the best it possibly can. People, I drive past these coffee shops, and I look at the lines going around the corner, and I say, how can you justify spending $6, $8 for a cup of fancy coffee when you could spend way less than that on daily supplements and get all the benefits and probably as much energy? So it's not more expensive. It's better for you. It's easier to do. I don't see a downside to this because I want my brain to work the best it possibly can. Now, B vitamins, B12 and folate, and other B vitamins, have been described as antidepressant nutrients. Folate, which is found in green leafy vegetables, avocados, and fresh vegetables, is involved in the body's production of neurotransmitters. In one study, people who consumed the most folate had the least risk of depression than those who ate the least. Now, in that study, I'm going to play devil's advocate. In that study, if you're eating a lot of fruits and vegetables and getting B12 and folate, chances are you're going to eat a lot of other good foods too. You're probably not eating spinach salads and romaine salads and then eating, fried ice cream. So it's kind of like, yeah, they ate folate, but they ate good all the way across the board. So let's talk about some strategies that we want to do to help reduce depression when it comes to nutrition. Consume more fruits, vegetables, nuts, and seeds. Hey, sounds like something Dr. Joe would say. Eat lots of foods rich in omega-3 fatty acids. Omega-3 fatty acids are essential fatty acids. That means you have to get them from an outside source. Your body can't produce them. Now, we can get them from animal products. They make omega-3 fatty acids. You can get them from salmon, very high in omega-3 fatty acids, or fatty fish, salmon, mackerel, things like this, tuna. But the fish don't make omega-3 fatty acids. Fish get it from eating smaller fish who eat algae. Algae produce the omega-3 fatty acids, what's called the DHA and EPA. The ones that we need as humans are produced by algae. So in my simple mind, I think, why am I eating fish who eat krill, who eat algae? What if I just ate algae? And that's exactly what I do. I take Dr. Joe's omega-3 fatty acid supplements every single day. And it helps my brain. Now, people ask me all the time, say, Dr. Joe, I've listened to your shows, I've listened to your podcast, I've followed you for years. How does your brain work at that level? How are you able to process so much information and just spit things out? And I say, my brain is no different than yours in most cases. I just take care of my brain. I feed it the nutrients that I need. If I'm going to grow tomatoes, I can't just put it in sand and expect it to grow. I've got to have vitamins, minerals, nutrients, got to have rich soil, I got to have sunlight, I got to have water. I have to make sure they're ripe when I pick them. So if I want my brain to work, I got to give it the right fertilizer, I got to give it the right stimulation to make it work properly. And I look at hospitals and I lose my mind. And I'm thinking, has anyone ever asked any of these patients, what can we do to get to the cause of your problem? We're great at treating symptoms, and I love treating symptoms. If I have pain, I want treatment. But we want to try to get to the cause of the problem. And that's when we look at the nervous system, digestive system, and diet. That's why I take super greens and essential source every day. It's why I take omega-3 fatty acids every day. Why I take vitamin D every day. Why I take B-complex, digestive enzymes every day. Adrenal support, men's hormone support. I'm getting older. I want to make sure my hormones are working, and they are. Compared to most men my age, I'm in really good shape. And so, you see these commercials after 40, testosterone starts to crash. Take this supplement, number one selling supplement at this one health food store. Yeah, what it is, it's fenugreek. Fenugreek, a lot cheaper than buying these fancy supplements online. Fenugreek, if you take fenugreek and eat a plant-based diet with boron in it, fenugreek and boron can help increase testosterone levels. There's a lot of other things that can help testosterone levels. You can take a stinging nettle. Stinging nettle has something in it that prevents testosterone from converting into estrogen. You can take cruciferous vegetables, broccoli, Brussels sprouts, cabbages. They have diindolylmethane, which helps prevent testosterone from converting into estrogen. It's called it's an estrogenic compound. It's not estrogenic. It blocks the estrogen. I'm sorry. So eating a good diet, nature has given you the things you need to help these things work and prevent testosterone from converting into estrogen. So I'm going off on a tangent here, but it goes back to how do I make my brain work, give it all the fuel it needs. Replace unhealthy foods with healthy foods. If you don't know what to eat, and I know a lot of you don't know where to start, and this is overwhelming, go to my website, drjoe.com. Type in the word 7 Deadly Sins of Nutrition. Listen to the show we did on the foods I want you to avoid. It's very funny, it's very lighthearted, it's very easy to listen to. Then type in the words, so what can I eat? And that tells you how to make this whole thing work. It's not hard. It's really easy. It's really inexpensive. It's so much fun. You feel great when you do it. And after a couple of days, those cravings for the bad foods start to go away. It usually takes about 3 days before the cravings start to fade out. But, there's the big but here. If you start eating the bad food again, you start craving those bad foods again. So you really have to say, I'm not going to do this anymore. So if you don't know what to do, the website, drjoe.com, is a great place to start. Now, depression is a debilitating mental disorder, severe impairment with the quality of life. The drugs don't work particularly well, bunch of side effects. So many people are searching for an alternative to antidepressant drugs. And so they said, what if there was a supplement, one specific supplement, or several, that would work really well, and in fact, in many cases, as well or better than prescription antidepressants. Randomized control study of chlorella. Chlorella, by the way, is in Dr. Joe's Super Greens. I put it there for a reason. In patients with major depression, subjects were randomized into standard therapy or standard therapy plus chlorella, which is about, they use 3/4 of a teaspoon a day. Pennies a day, literally, of chlorella. Significant improvements in physical and cognitive symptoms of depression as well as anxiety. Wow. 3/4 of a teaspoon. That's a couple of cents a day, maybe a nickel a day. That study, dramatic improvement. Now, if you take Super Greens and Essential Source, in the Super Greens, we're going to have the chlorella and the spirulina and the omega-3 fatty acids and the wheatgrass and barley grass and alfalfa grass. And so when I formulated those two formulas, I said, how many different ways can this supplement help people? And one of the ways that chlorella helps is that studies have shown it can help with depression. It can also help with liver disease. Double-blind placebo study on chlorella and liver disease, non-alcoholic fatty liver specifically. And thanks to the obesity epidemic, now affects 1 in 4 people on Earth. Fatty liver, 1 in 4 people on Earth. Non-alcoholic fatty liver. If you're alcoholic, that's different. So let's see, 1,200 milligrams of chlorella a day. That's about a half a teaspoon they used. Closer to about a nickel a day. That's how much it costs, 5 cents. Significant drops in liver inflammation, perhaps because they lost significantly more weight, which was another benefit of eating right, which would explain a significant improvement in fasting blood sugars. They concluded in this study that chlorella has significant weight-reducing effect and meaningful improvements in liver function. It cost 5 cents a day to take a half a teaspoon of chlorella. Now, I put that with other stuff in the super greens to make it even better. So if we have depression, if we have liver issues, if we have high cholesterol, why don't we do these things? Hundreds of subjects found that taking chlorella dropped their low-density lipoproteins 8 points on average and even dropped their blood pressure a few points. 4 grams or more a day for at least 8 weeks was the magic formula. So once again, that's about 2 teaspoons they're using now. That's a lot of chlorella, but we use a scoop of it in our Dr. Joe's Super Greens. We've seasoned it or flavored it. We have mint flavor, we have hemp, and we have plain. Of the Super Greens, I like the mint and the hemp best. The plain is plain. It's boring. I don't like boring. I like excitement in my life. And so if you add the Super Greens, the essential source, so many different benefits. And so we can deal with depression from multiple ways. Number one, we can take medication for it, which works 1/3 of the time. We can try changing the diet, which works almost 100% of the time. We can add supplements like Super Greens and Essential Source and chlorella, magnesium, which is found in the Essential Source as well. And that works in most cases very well. Sometimes it's a physical problem. So with depression, it could be pain. It could be digestive issues. It could be absorption issues. We talked about probiotics as well earlier. So if you take Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's Probiotics, why wouldn't you do that? Let's assume it doesn't work. So what? You spent a couple of bucks. You felt great. You took nutrients that the body needs. And after 60 days, you go, I didn't like that. I'm not going to do it anymore. Okay, you gave it a shot. Thank you for trying. If it does work, which it probably will, almost always does, you'll say, like everybody else does, why didn't I do this sooner? Why did I suffer for so long? Why didn't my other doctors tell me this? And the answer is, I don't know. So if you go to our website, drjoe.com, and just type in the words 7 Deadly Sins of Nutrition and So What Can I Eat, those 2 different shows, that'll tell you what to eat, what not to eat. We already talked about the supplementation already. If you have acid reflux, heartburn, burping, gas, bloating, how many people have that? Raise your hands. A lot of people have these issues, and it's a physical problem. The other day, I had 3 new patients in the morning that I saw. My other doctor saw other patients. All 3 of them came in for one reason, digestive problems. And when I checked them out, we found that they had pinched nerves in the low back that went to their digestive system. Their stomach was up against their diaphragm. Their diets were junk. Keep it clean. It's a family show. And all 3 of them were so excited because finally somebody had given them hope. So if you have a digestive issue, heartburn, acid reflux, many times the stomach is pushed up against the diaphragm. We need to physically pull it down away from the diaphragm. And my team of doctors are really good at doing that because I have this problem. And I've trained all of them on me on how to do this. So I know they're doing it right. So that's great. We talked about earlier about the nerve supply to the organs. Chiropractic care is the most effective, least expensive treatment for back pain. So most people think chiropractic care, back pain. But 90% of your nerves don't feel pain. So you can have pinched nerves and not know it. So for example, you don't feel your blood pressure, you don't feel your kidneys, you don't feel your gut bacteria. So we want to test the nerves going to the organs as well as the organs themselves. And that's what my team of doctors do on all our patients. And so if you'd like to make an appointment to come see us in the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. We would love the opportunity to help you get well and stay well naturally. If you need drugs, if you need surgery, if you need pain management for injections, we have that available. But let's start with this first. drjoe.com. You can book it right online or call us. The number's right on the website. We accept people with all insurances. Depends what your coverage is. We accept people with no insurance. About 50% of our patients don't have insurance. And it's still the most affordable treatment you can come up with. Even if you have insurance, sometimes it's cheaper to not even use the insurance. Because you have $4,000 or $5,000 deductibles. We're way less than that. So it's quick, it's easy, it's effective, it's relatively safe, it's less expensive than what you're doing right now. It's covered by most insurances. Why wouldn't you do it? So come in, let us check your spine, let us check this digestive system, let us check your stomach if it's up against the diaphragm, let us do nutrition evaluation with you, and let's do everything we can to try to get to the cause of your problem and not just treat the symptoms. And if you're ever in a car accident, please, I'm begging you, come see us immediately. There is so many scam doctors and lawyers out there, it makes me sick. You'll get a call from, hey, this is Bob from your insurance company. You need to go see, Dr. Bob and Attorney Smith. No, that's a scam. Your insurance company, no one is ever going to call you and tell you to go to a doctor. If your attorney says to you, you have to go see my doctor, fire that attorney immediately. The attorney should not be dictating your health care. And attorneys think they are, and fire them if they tell you to go to a different doctor. I've had people come in, I got this attorney, Dr. Joe, and he said I had to go see his doctor. No, that's a scam. Don't do it. Fire them immediately. And so I want you to get the best care you can, the best legal representation you can. We want to do everything we can to get you well and keep you well. So drjoe.com. Normally the first visit for us is $712. For my listeners, we've reduced that to $299. Exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. X-rays alone anywhere else is going to cost you more than that. So drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. If you have a topic you want to learn more about, go to our website, type in the search bar, hey, anxiety, depression, probiotics, high blood pressure, diabetes, obesity. Chances are we've done a podcast, an article, a blog on it. If you still have questions, a little bot pops up on the website. Send me your questions through the website. I'm happy to answer your health questions for you, your friends, and your family. Follow us on social media at Dr. Joe Esposito. We post every single day. We post live podcasts. You get to see my pretty face. So follow us on social media, and it's a great way to get information every single day, get a little health tip. And sometimes we have to feed you, jokingly, these health tips so it's not all at once. You can handle a little bit at a time. If you like podcasts, go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it. That's our podcast. We have hundreds of hours of podcasts on your podcast server right now. If you want to dig deeper, we have over 3,000 hours of podcasts on our website. We have audio, we have video, and we have blogs. So if you just like audio, if you like to watch, if you like to read, we have it all there. I've written books. They're on the website. All the supplements we talk about are available on the website, drjoe.com. You can order them and we'll ship them to you, or come by and pick them up. We'd love to see you. And while you're coming by and pick them up, set up a consultation. Let's see if there's anything we can do to naturally get you well without drugs, without surgery. Folks, I'm Dr. Joe Esposito. Please follow us on social media at Dr. Joe Esposito. Tell your friends about the show. Again, drjoe.com is the website. We'll catch you next time.